Thank you, Dr. Levin, for joining us today and offering us some input on what's happening currently with the coronavirus pandemic. I was wondering if you could just start off by introducing yourself.
Well, my name is Eleanor Levin, and I'm a cardiologist, currently the scientific advisor for Moving Analytics, a provider of home-based cardiac rehab, as well as a clinical professor at Stanford in the preventive cardiology, general cardiology, and women's heart health areas, as well as teaching medical students, residents, and cardiology fellows at Stanford University. Formerly, I was chair of the Chiefs of Cardiology in Northern California Kaiser, over 23 medical centers, as well as in charge of cardiac rehabilitation for the entire region of 4.3 million members currently, for several decades. The Moving Analytics provides a home-based remote cardiac rehabilitation solution, which follows the program that we used successfully at Kaiser Permanente in Northern California for more than 3 decades with outstanding cardiovascular outcomes.
That's excellent. Thank you so much. So just to get back onto the situation currently, with so much fear and anxiety about the coronavirus, I wanted to get your input on what is happening today. Social distancing, community shutting down, high-risk patients, what does it all mean?
Well, we're in the midst of a pandemic of a virus, a novel virus, the COVID-19. And in order to flatten the curve, as the epidemiologists say, and reduce the stress on our healthcare system, we have to slow the pandemic down. The only way we can slow this down, since we don't have vaccination or antivirals that are highly effective, is with social distancing and actually shutting down the communities. The high-risk patients tend to be patients over age 60 and those with chronic medical conditions, which absolutely includes patients with cardiovascular disease, cardiovascular risk factors. So it's even more important for our older patients with cardiovascular disease and our younger patients with cardiovascular disease to affect social distancing.
So recently we've heard stories of cardiac rehabilitation programs being shut down due to the coronavirus. How will these shutdowns impact patients who are currently in rehab or those that have just had an event or are being just discharged from the hospital?
Well, currently with the shutdowns, it's not recommended to go to a gym. And that's because the virus can stay alive on surfaces for some time. So even with adequate sanitization, there can be a problem using gymnasiums. Now, we know that cardiac rehabilitation saves lives and reduces hospitalizations. So this is a big problem with the bricks and mortar facilities.
Thank you. Is it okay for patients to wait until the pandemic passes to start or continue cardiac rehab?
Well, I think right now, with the risk of going to the gyms and not being able to achieve social distancing, it is a legitimate concern to not show up for cardiac rehab. However, every month that they wait, we're losing valuable time in terms of reducing cardiovascular events. So that's why remote solutions are really, really important. Right now, they're recommending that in terms of medical visits, that those be converted to telephone or video and patients don't go to the hospital. So this is a legitimate concern.
Are you aware of new tools or technologies that are available that can be useful to keeping people on track? as they wait for the dust to settle?
Well, I think that you can use your wearables to try to increase your activity to 30 minutes of exercise daily to shortness of breath, but can still talk. We can try to keep a good diet. You can try to go online and look for information on the American College of Cardiology website, on the American Heart Association website. But there need to be, telehealth solutions soon, which you can ask your own doctor about.
I see. So what are the short-term things you tell your patients today with regard to cardiac rehabilitation?
Well, I tell them to keep exercising, keep walking to shortness of breath, but can still talk, and to try to keep eating your correct diet
I see.
and take your medicine. Those are the most important things.
Okay. What should providers know about virtual rehab companies like Moving Analytics?
Well, I think these are wonderful solutions because they're already packaged with all the right ideas and all the right benchmarks to keep the patients on track. Um, I think this is going to be the solution of the future, but it's even more important this year because this epidemic, also pandemic, is going to keep going on for several months. This is not going to just be a few weeks. So it's so important for patients to have solutions now and not wait a year.
Thank you for that. What do you think payers should do for virtual cardiac care in today's age?
Oh, well, I think all the payers are realizing they've got to pay for telehealth solutions in all aspects of healthcare because we can't have people coming in and overwhelming the healthcare system. And we physically don't want them out because of reducing the social distancing that we need.